Good evening, I'm Kimberly Brown.
And I'm Phil Doherty. Thanks for joining us. We begin tonight with the ongoing debate over health care reform and how it's playing out in local politics.
Concerned voters attended a town hall meeting in Milan today. Republican Bobby Schilling is running for Illinois Congressional District 17. He met with them today discussing his views on health care and how he hopes to make changes. First on Fox, Natalie Tolomeo has more.
About 150 concerned voters came out today, hearing more on the ongoing health care reform debate from Republican candidate Bobby Schilling.
He will run against Democrat Phil Hare for the 17th district. Schilling says health care is a top priority.
This is something we've got to get it right. This is a huge thing, and it can't be here's your option and this is the only option. Let's throw this through.
Schilling opened the floor, answering questions and hearing opinions on health care.
I think the biggest message that I got in visiting with people from this function is that the people just feel like they're not being listened to at all.
Hospital gowns were passed out, like the sight we saw on the White House lawn earlier this month. Schilling says not everyone is a doctor, but everyone is a patient.
It costs health care so much because we got the best in the world. You want the best, you pay for it.
Members of the mostly Republican crowd we spoke with share Schilling's beliefs on reform.
Hopefully we can get him in Washington and he can turn it to the right direction.
I think he knows what he's talking about, and I think if the government gets into it, we're all in trouble.
While candidate Schilling says Washington must put more work and effort into health care reform, Representative Phil Hare says he's proud of the bill the House proposed last week. In the newsroom, Natalie Tolomeo, Fox 18 News.
Congressman Phil Hare, who holds that seat, will be meeting with Rock Island County Health Department officials tomorrow. They plan to discuss the ongoing H1N1 vaccine effort. The U.S. House could vote on its health care reform package this week. Democratic leaders say it'll cost under $900 billion for more than 10 years. But the nonpartisan Congressional Budget Office says it will top $1 trillion in that time. It contains the controversial public option. Even if it passes the House, the public option faces rough odds in the Senate.
The Congressional Budget Office evaluated that plan and said that the public option would charge more in premiums than the average premium charged by the private insurance companies. Well, if that's the case, what are we doing it for?
Supporters of the House public option say it will cover millions of uninsured Americans. To pay for it, there's $460 billion in new taxes on the wealthy and $400 billion in cuts to Medicare and Medicaid. Opponents say the reforms will blow a bigger hole in the deficit, erode the quality of care, and levy billions in new taxes. And the House version of the bill would force fast food chains to post calorie counts on their menus. That provision is buried deep in the 1,900-page bill. Supporters say it will help fight obesity and health problems linked to being overweight. Opponents say it's just a growing what they call the nanny state. Vending machines would also have to post calorie counts.